Dear viewers, today I am going to discuss on a very important skin disease of dog, which is known as Canine Pyoderma, and it is a really frustrating disease to the veterinarians. It is a bacterial skin disease caused by staphylococcus intermdius, and this was previously known as staphylococcus pseudo-intermedius, which was previously known as staphylococcus intermedius. Earlier it was known as staphylococcus intermedius, but now it is known as pseudo-intermedius. And if you consider the canine pyoderma, it can be divided into two. One is superficial or surface, the other is deep pyoderma. That means one remains from the superficial layer, the other goes in the deep layer. And so far the superficial pyoderma is concerned, we do have problems like bacterial folliculitis, bacterial overgrowth, Impetigo, Intertrigo, that means skin fold dermatitis. Then we get Mucocutaneous pyoderma and Pyotraumatic dermatitis, which is known as acute moist dermatitis. And this acute moist dermatitis is sometimes known as acute moist dermatitis, sometimes known as hot spot, because all these microabscesses, they glue together and abrasion takes place. While abrasion takes place, then a red spot develops. Therefore, this is also known as hot spot. Then in deep pyoderma, we have got Acral leak dermatitis, where the dog goes on licking the area. Therefore, it becomes very difficult to treat, because whatever ointment, medicine you apply, the dog will go on licking, and ultimately licking, and leaking may be so extreme in certain cases that it may cause ulcer. So acral leak dermatitis, where the dermatitis occurs in certain areas, certain points or joints, especially joints of the forelegs, and dog goes on fetlock areas mostly, goes on leaking, and therefore ulcer may develop. And it is very difficult to treat, because whatever ointment or medicine you apply, the dog will lick it, and therefore we don't get any result. Then we have got bacterial dermatitis and Callus Furunculosis. That means obstinate abscess is known as furunculosis. Then we can have canine acne, just like our pimples, canine acne, or pedal folliculitis, or post-grooming furunculosis we may get. So far the superficial pyoderma and the deep pyoderma, the difference is that one is in the superficial layer of the skin, other goes little deep of the skin. But why we give the treatment of superficial pyoderma or deep pyoderma? We get the result, but after some time again there is recurrence. So why there is recurrence? The recurrence may be for two reasons. One reason is that therapy is not adequate, inadequate therapy, or duration of the therapy is not adequate. Actually, as a rule of thumb, if you give antibiotic, it has to be given 1 more week after the clinical recovery, because recovery is two. One is clinical recovery, other is bacterial recovery. So you cannot see the bacteria, and therefore if you see on the superficial layer, there is no lesions, you may think that my dog is alright, but it is not so. One has to give further treatment of at least 1 to 2 weeks to remove the problem. But still then sometimes we find that there is a recurrent canine pyoderma. That means the disease again reappears. why the disease reappears? The disease reappears as a result of certain underlying causes. What are those causes? One is endocrinopathological causes. What are the endocrinopathy? Endocrinopathy, of which we get hyperadrenocorticism, which is otherwise known as Cushing disease. If this Cushing disease exists, this pyoderma, whether superficial or deep, will continue to exist. And therefore, this point has to be taken into consideration. Second is hyperestrogenism. Of course, the incidence of hyperestrogenism is very less. But so far the hypothyroidism is concerned, it is more or less observed in dog. And in hypothyroidism, I tell you, if you suspect a case of hypothyroidism, in that case the alopecia or hair loss will be bilaterally symmetrical. If this side affects, that side also will be affected. At the same time, the animal will have the tendency to remain in hot areas. We call hot area, hot sickness. And third is the tail will be very furless or alopecia, or we sometimes call rat tail, that will be seen in case of hypothyroidism. So if you give treatment for hypothyroidism, that means thyroxine therapy, at the same time pyoderma therapy, then you may prevent the recurrence of the canine pyoderma. Then there will be hypersensitivity dermatitis, that is atopic dermatitis. Is very, very difficult problem, but nowadays various medicines has come up, we can try with that. The atopic dermatitis is very, very obstinate problem. Then we have got flea allergy dermatitis. In case of flea allergy dermatitis, that means FAD, flea allergy dermatitis. In that case also, there is hypersensitivity reaction, as a result of which the dog will continue to itch the area and there will be aggravation of lesions. In that cases, one has to take care of the flea by using any agent or any deterrent for flea. And next is food allergy. So one has to see that what are the foods are given. That means allergic roll call of the food has to be done, and the food is considered to be responsible, that has to be eliminated. In that cases, we will get a good result of pyoderma therapy. Then there may be keratinization abnormalities, that means there may be ichthyosis, there may be primary seborrheic dermatitis, there may be sebaceous adenitis, and there may be gene responsive dermatosis. We have seen that if there is deficiency of gene, in that cases there is again recurrence of the pyoderma in spite of treatment. Again there is recurrence of pyoderma because zinc, there is less zinc. That means zinc responsive dermatitis. That means one has to give some zinc preparation along with the antibacterial preparation. So now we can diagnose this disease by looking at the clinical signs, typical clinical signs in different parts of the body, hair, and we can go for microscopic cytology or skin scraping. Skin scraping, because if you make the skin scraping, it will be possible to locate whether there is sarcoptes or dermatitis is responsible for this or not. Because we know dermatitis remain in the hair follicles, but they invite the bacteria to come, right? Likewise, sarcoptes, they also invite the secondary bacterial infection. In that case, that's why skin scraping is necessary. Sometimes dermatophyte culture is required. That means we have got the fungal culture media, dermatophyte test media, dextrosagar media. We can go for identification of the dermatophytes. right? So so in this way we can diagnose the problem. So cytology means impression cytology, skin scraping, tip preparation, microscopic evaluation, bacterial folliculitis in bacterial, and culture and sensitivity. That is very important. So what the treatment is, diagnosis is concerned. Then differential diagnosis, one has to go for dermatitis, dermatophytosis, malassezal dermatitis. So far the treatment is concerned, I will suggest the dog owner to consult the veterinarian or very expert veterinarian who can look after the skin effectively. And since there are two types of lesions, one is superficial, so in that cases only topical preparations or topical antibacterial medications may be good enough to combat the problem. So topical antibacterial therapy, and if there is very itching lesions or pruritic lesions, in that cases we can give a short course of oral anti-inflammatory dose of methylprednisolone. But methylprednisolone should be given very judiciously if it is at all required or judged by the veterinarian. And already I have told about the topical therapy, the medicine which generally is being used, preparation containing mupirocin or silver sulfur diazine, which can be applied. And so far the generalized skin infections, I tell you a course of your antibiotic may be required based on the antibacterial sensitivity test, antibiogram. We can have to give a antibacterial course. But one thing one should remember, that if you see that after giving the treatment for 10 days or 15 days, there is recovery and there is no visible lesions, but I will request that if you see the clinical improvement, but don't get complacent, but at the same time I will request that you should again extend the treatment for a further period of 1 to 2 weeks to heal the microbial populations, so that microbial recovery and the clinical recovery both are there. So far the deep pyoderma is concerned, here again I tell you, clipping of the lesions or your trimming of the lesion is very, very important. After trimming, if you can apply the medicines very effectively, and you can locate the lesions and the depth of the lesions and the nature of the lesions can be visualized. I think this is an overview on canine pyoderma in dogs. Thank you.
যদি আপনাদের আমাদের এই চ্যানেলটি ভালো লাগে তাহলে সাবস্ক্রাইব করুন এবং শেয়ার করুন।